It would not be Surgical Services Awareness Month if we did not take on the topic of preoperative clearance. Hi, Shannon DeConda here with NamUs. Thanks for joining today. We're going to talk about preoperative clearance. Now, I want to address Medicare because most commercials follow Medicare, but I promise we're going to use examples that are non-Medicare as well. So first of all, is preoperative clearance covered? And the answer is yes, when it's medically necessary. That kind of becomes our problem and creates the rigidity that we have. A lot of times, our providers, our surgical providers, are sending patients for preoperative clearance who don't meet the need for medically necessary clearance. Let's use a couple of examples here. We have a patient who is seeing a GI provider, and they need non-surgical intervention, and the GI specialist is sending them for preoperative clearance. That patient goes to their PCP, they have diabetes and cardiovascular disease. Does it make sense? Does there medical necessity in that patient requiring clearance? Seems like probably so, right? Okay, that makes sense. There's medical necessity there. Now, we have another patient seeing the same GI physician. This patient is 65, 66, 67, younger Medicare patient, no comorbidities, no problems, generally a healthy patient. The GI surgeon also sends them to the primary care provider for preoperative clearance. Is there medical necessity? That's our problem. So a lot of surgeons are sending patients back and saying, before I operate, you need to be cleared. And it seems like this is kind of a push and pull. I want to be cleared legally by sending you back to your primary care or to your cardiologist or to your endocrinologist or to your pulmonologist. And I want them to say, it's okay for me to operate on you. However, that clearance is only reimbursed when it is medically necessary. So that puts our PCP in a very tight situation. Now, you notice I said PCP because usually if you're a cardiologist or one of the other specialties, those patients tend to have the medical necessity. It's the PCP here that is usually left holding the bag. They're asked to clear patients a lot of times that don't necessarily need to be cleared. We see this a lot of times too with children with dental issues. The dental needs clearance for these children, but the children are relatively healthy. There's really nothing wrong with them, but the dental wants the pediatrician to clear them. But they're healthy children. There's no need for that clearance except for legal liability issues. Now, the problem is we have providers who are stuck, and we have coders and auditors that are sitting looking at these claims going, how do I bill them? Now, some coders and auditors, especially like these pediatric patients, we'll go ahead and do the annual physical, and that works. That's what you're in essence doing for that child is you're going to end up doing a full annual exam on that child to make sure they're healthy to undergo surgical intervention. That makes sense. And for adult patients that are non-Medicare, you could do the same thing as do an annual physical exam. That works. But for a Medicare population who does not get that preventive wellness, because remember, welcome to Medicare physicals, your annual wellness visit, those are not physical exams. There's even no exam on a subsequent wellness visit, an SWV and an AWV. So when we think about those services and we think about these Medicare patients coming in, what do you do with them? Because I'm going to tell you, the PCP doesn't want to push back on their referrals. They want to make sure that when they send their patients to those surgeons, that those surgeons are going to get their patients in. So we come to this deadlock position, and I'm going to tell you, it's not a great place to be in. So a lot of times our PCPs see these patients and they do the best they can with the billing. I'm going to tell you, we need to really look at these claims, and it's a great place as an internal auditor for you to dive in and look at how are these claims being treated in your office. How can you help your providers with these claims? A lot of these will end up having to be a cash pay patient if you really look at how they're being documented. Preoperative clearance for non-medically necessary reasons, unfortunately, are not covered unless our provider notes there's a reason that was medically necessary for them to have preoperative clearance. This is very touchy. It's kind of almost politically charged in our healthcare related environment. So if you have questions, I'm always here to help. So leave comments here on what you think of this topic. How can we help our providers understand this topic, and especially our surgeons understand some of these patients you're well adapted to make this clearance for surgery. I hope this helped, and if you have any other comments, please post them here. I hope you have a great day, and I'll see you next time.